Hi everybody, so I'm going to be doing my presentation on ovarian cancer screening. To start, I'm going to go over an anatomy overview. So the ovaries are reproductive organs that contain eggs. These eggs travel from the ovaries through the fallopian tubes into the uterus, where if the egg is fertilized, it would settle and eventually grow into fetus. The ovaries are also the main source of the female hormones estrogen and progesterone. And in the ovaries, there are three main types of cells, which is epithelial, germ, and stomach cells. Now, what is ovarian cancer? Ovarian cancer is a growth of cells and is a type of cancer that occurs in the ovaries. Each of the previously mentioned cells within the ovaries all have the potential to develop into a tumor. Epithelial tumors originate from the cells that cover the outer surface of the ovary. This is the most common type of ovarian cancer, and it can be further divided into subtype 1 and subtype 2. Germ cell tumors originate from the cells that produce the eggs. Stromal tumors originate from the structural tissue cells that produce estrogen and progesterone. These have the potential to be benign or malignant. Ovarian cancer mainly develops in older women. About half of the women who are diagnosed with ovarian cancer are 63 years or older, and it is more common in white women than it is in black women. Common symptoms associated with ovarian cancer include fatigue, upset stomach, back, pelvic, or abdominal pain, pain during sex, constipation, changes in a woman's period, bloating, weight loss, trouble eating or feeling full quickly, urinary urgency or frequency, pelvic exam abnormalities such as during a pap smear. If ovarian cancer is detected early, the 5-year survival rate is 90%. However, it typically is not diagnosed until stages 3 or 4, in which the 5-year survival rate is less than 30%, which is why it's so important to listen to your body and if you have any of these symptoms, to go check it out. Risk factors associated with a greater risk of developing ovarian cancer include the presence of BRCA1 or BRCA2 mutations. These are genes that produce proteins crucial for repairing damaged DNA, thus helping to prevent cells from growing and dividing uncontrollably, which can lead to cancer. Family history, nulliparity, lack of breastfeeding, lack of hormonal contraception use, postmenopausal status, 50 years or older, smoking, and a previous history of breast, endometrial, and/or colon cancer. These are just some ovarian cancer stats. About 20,890 women will receive a new diagnosis of ovarian cancer. About 12,730 women will die from ovarian cancer. Ovarian cancer is one of the leading causes of death among women. A woman's risk of getting ovarian cancer during her lifetime is about 1 in 91. Her lifetime chance of dying from ovarian cancer is about 1 in 143. The rate of ovarian cancer deaths has decreased by 43% since 1976. The test utilized to screen for ovarian cancer was minimal. So these are the tests that had evidence, but it was only for pre and postmenopausal women for high risk though. So they used the ultrasound color Doppler for the ovaries, ultrasound pelvis transabdominal, and the ultrasound pelvis transvaginal, but the pre and postmenopausal women for average risk had no evidence-based appropriate technology to screen for ovarian cancer. These are charts demonstrating what I just said previously. So as you can see, this is for post and premenopausal women at an average risk for developing ovarian cancer. And there is no technology or screening device that they find is appropriate and evidence supports that it would be appropriate to use. And these charts show pre and postmenopausal women at high risk for developing ovarian cancer. And again, it just shows that ultrasound color Doppler for the ovaries, ultrasound pelvis transabdominal, and the ultrasound pelvis transvaginal may be appropriate for ovarian screening, but the rest of the technology is not. These tests are used to detect spreading, not for ovarian cancer screening, but to see if the cancer has spread elsewhere. So CT scans do not show small ovarian tumors well, but they can see larger tumors and may be able to see if the tumor is growing into nearby structures. MRI scans are not used often to look for ovarian cancer, but rather if it has spread elsewhere. X-rays are done to determine whether ovarian cancer has spread to the lungs. A PET scan is not as detailed as a CT or MRI scan, but it shows if abnormal areas seen are likely to be cancer or not. Your doctor will or may order blood count tests to make sure you have enough red blood cells, white blood cells, and platelets. A biopsy checks to see if the tumor is cancerous, and they may order a laparoscopy, which is a procedure that uses a thin lighted tube through which a doctor can look at the ovaries and other pelvic organs and tissues. This is an image of a normal right ovary on the ultrasound. As you can see, there's no bumps, no lesions. It's just normal. This shows a right ovary with a mass. It's that circle. I have that arrow pointing to it. It's that large circle. This would be considered a mass and something they would want to further investigate if they found this on a woman's ultrasound. Here we have an image of ovarian cancer on an ultrasound with color. The green dotted line outlines the mass, and the yellow line also points to the vascular areas. The vascular areas are those light up areas, and that just shows there's an increase of blood flow to this, which would be indicative that something is not right. This is another picture of ovarian cancer on an ultrasound with color. Again, it's those light up blue, red, yellow areas that would be seen on ultrasound that would be concerning for the provider, and they would want to further look at it. So again, like the yellow line or arrow points to one portion of it, but as you can see, it's all over the ultrasound. There's these dots. Here we have ovarian carcinoma, and this is what it would look like on an MRI. It's this big mass that's circled, the yellow arrows pointing it out, and these are just 3 different views of this mass. Then when you go to this slide, we have an ovarian cyst from the MRI point of view, and as you can see from the previous slide to this slide, from the MRI imaging, they do look very similar, and if either of these images were shown during the MRI, there would be needed for further testing. How is the ovarian cancer stage determined? So they use the TMN staging system, and there are 3 factors to stage the cancer. So T is for tumor, has the cancer spread outside the ovary or fallopian tube, has the cancer reached nearby pelvic organs like the uterus or bladder, N is for nodes, has the cancer spread to lymph nodes in the pelvis or around the aorta, M is for metastases, has the cancer spread to fluid around the lungs or to organs such as the liver or bones, and stage 1 through 4. Treatments include surgery, chemotherapy, radiation therapy, hormone therapy, immunotherapy, and targeted drug therapy. Approximately 70% of patients will experience an ovarian cancer recurrence. The stage of cancer at diagnosis significantly influences recurrence risk. So stage 1, it's a 10% chance of coming back, stage 2, 30%, stage 3, 70 to 90%, and stage 4, 90 to 95% chance of coming back. These are some differential diagnoses that present similar to ovarian cancer, which is why it's so important to go get checked out if you're experiencing any symptoms, because it could be one of these, but it could be ovarian cancer. So some of the diagnoses include appendiceal tumors, benign lesions of the uterine corpus, bladder distension or urinary retention, bowel adhesions, colon cancer, embryologic remnants, fallopian tube and broad ligament tumors, fecal impaction, gastric adenocarcinoma, hydrosalpinx, AUTI, IBS, low-lying cecum, metastatic gastrointestinal carcinoma, ovarian torsion, pelvic abscess, peritoneal cyst, retroperitoneal mass, urachal cyst, uterine abnormalities, and or uterine fibroids. Physical therapy plays a very important role in ovarian cancer. While we may not be the main people who screen for ovarian cancer, it is still important because oftentimes patients will tell us about what's going on and some symptoms they're having, even if it's not related to the direct body part that we're treating. So hearing those red flags and hearing the symptoms and knowing when to refer out and advise them to see a specialist is very important. Now, as far as treatment goes, so physical therapy improves daily function and quality of life. Treatment regimen for these patients are very patient specific, and it depends on the stage and the treatment they're getting, and etc. So something that's come to be very popular with this population is pelvic floor physical therapy. Physical therapy also helps with patients' fatigue, their endurance, their strength, their range of motion. some scar tissue mobility if they had a surgery, and we definitely offer education and support to them. Pelvic floor physical therapy is very important for this population. Pelvic floor therapy helps restore and strengthen these crucial muscles. These muscles serve several vital functions, such as supporting bladder and bowel control, maintaining sexual health and function, stabilizing the spine with deep abdominal muscles, regulating abdominal pressure, supporting lymphatic drainage post-surgery. After cancer treatment or surgery, these muscles may become weak and or uncoordinated. When organs like the uterus are removed during cancer treatment, this can create a void in the structure support, which allows other organs such as the bladder or rectum to shift downwards. So these physical changes can affect how your pelvic floor functions. So this is why pelvic floor physical therapy helps you adapt to these changes, strengthen and retrain your muscles to provide the proper support in this new configuration. These are just my resources, and thank you so much for listening.